Welcome to On the Beat. Today we're going to cover a subject that you're hearing all over the place, GLP-1. So our friends from Gastroenterology Associates of Columbus and Starkville are here to help sort out all the information we need when it comes to this weight loss medication. So Dr. Ricky Johnston and also to Dr. William Gillespie. So tell us, what are GLP-1s?
Yes, so GLP-1 stands for glucagon-like peptide, which is a it's a naturally occurring hormone in your body. So everybody has this circulating, and so they've figured out a way to make this hormone and can deliver it for a variety of reasons. And just to clarify, we're going to talk about the GI effects of it today, not necessarily what people would be taking it for from an indication standpoint. But this includes medications like Wegovy, Mounjaro, and more commonly Ozempic. I think that's what most people know this as. So they initially were studied as diabetic medications to help people treat their diabetes. And in the course of these studies, it was discovered that they led to profound weight loss, which is where the craze kind of took off. And so that's why you're hearing a lot about them now, is people are taking them not because they have diabetes, but because they're trying to take them to lose weight. And so I think one of the cool things that we don't know is, in addition to helping with those two issues, there's this whole other plethora of possibilities out there that are still being investigated. What they've also seen is that for some reason they might decrease addictive tendencies.
Interesting.
So people who've had gambling problems or alcohol and drug addiction or other things like that have taken these, and it can reduce, help people wean off of addictive,
substances.
Activities.
Yeah. So people come to you because of what we commonly hear about this medication is digestive issues.
Right. Yep.
So tell us what you tell patients that come to you that are experiencing digestive issues when they're taking this medication.
Well, frequently the most common side effects of these medicines, they will kind of decrease the motility of your GI tract. So your stomach won't push food out quite as quickly, can lead to a lot of constipation. And so a lot of the symptoms are nausea, getting full really easy, sometimes vomiting, bad constipation, abdominal pain, sometimes diarrhea. Mm-hmm. They're all fairly common symptoms, but they occur very commonly in people on these medicines.
So what can somebody do if they are on these medications or are taking it for diabetes, they need the medication? How do you deal with the discomfort?
Well, it depends on, I guess, how long they've been on it. So if they have just started it, then a lot of times this may be a transient thing. If they can kind of push through it after a few weeks, maybe a month or two, their body might get acclimated and they might to become more tolerant of the medications. If they've tried waiting through it and they're not getting better, or if their symptoms are very severe, and that's going to be to each his own. But if you're having severe abdominal pain, if you're having severe constipation or bloating, or if you ever have bleeding, things like that, you'd want to call us or call your primary care to talk about. But generally, we can make some meal adjustments, tell them to eat small, frequent meals as opposed to bigger meals, avoid greasy foods, avoid high sugar foods. So maybe some diet changes. And
that can help.
Yeah.
And then things like constipation you can treat with normal constipation meds, and that will frequently help.
And in extreme measures, you just have to, you can maybe reduce the dose of the medication, but sometimes you just have to stop it.
Now, question that I'm sure you get asked, is this going to last forever? What happens if I go off the GLP-1? Will I still have these symptoms?
Typically, the symptoms will go away once you stop the med. Now, sometimes it can take a while. Sometimes their body takes a while to regulate itself. So sometimes you get better a month later, 2 months later. But eventually, your system will generally go back to where it was before.
Okay, so good news for that. Thank you both so much. Good information since so many people are on this medication. And that's today's On the Beat.